Hello again. One has grown so used to weird headlines about the National Health Service over the last couple of years that it should not really, I suppose, come as a surprise that they should be tackling a winter crisis in the midst of a record-breaking heatwave. I give a link in the description to just such a headline from today's Daily Telegraph. It reads, "Avoid A&E, say NHS as winter crisis bites early." At one time, reading a headline of that sort would have had you doing a double take or perhaps bursting out laughing at the absurdity of such an idea. But nobody really feels like laughing at the moment. The fact that 1,000 people a week more than average are dying every week in this country from causes which have nothing to do with COVID is sufficient to stop us finding anything even remotely amusing about this catastrophe. What can possibly have caused such a hideous state of affairs? Remember in 2020 when some of us were saying that lockdowns would be a disaster which would both trash the economy and also cause more deaths than COVID a few years down the line? How angrily people reacted to this. Why, how could we be worrying about the cost of things, looking at the amount of money being spent at such a time? Did we think that money was more important than people's lives? Disgusting. Then too, we had to protect the NHS. Anybody remember that? That we had to save the NHS by avoiding using it unless we had COVID. Only the most selfish of people would have gone to a doctor or visited a hospital to have worrying symptoms checked out or to receive treatment for cancer or heart trouble. A couple of years of that sort of thing has guaranteed that we will see an epidemic of cancer, strokes and heart attacks. On top of all this, a flu epidemic is anticipated because we haven't had one in this country for a few years now. This is why there is a winter crisis in August. It was all foreseen by some of us. It might be recalled that I was suspended by YouTube on a number of occasions for talking about COVID and suggesting that the cures being advocated were likely to prove a good deal worse than the disease itself. So it has proved. The mad schemes such as furlough and all the rest of it, which basically entailed the government printing money, have caused the most dreadful inflation. This in turn will cost lives, because many people, especially the vulnerable and old, will be facing choices about whether they can afford to heat their homes or buy food. It is as stark as that. Do people really not think that this is going to cause deaths from hypothermia? Does anybody think that an old person with flu will not find his or her chances of survival greatly reduced if the house is freezing cold because the old person can't afford to put on the heating? Again, those of us who warned of this were portrayed as heartless people who thought only of money. As the summer ends, the number of deaths in this country will soar. The weekly mortality rate is already rising steeply, and some doctors are predicting a catastrophe, with countless deaths and hospitals quite unable to cope. All this could have been avoided, of course. The average age of those dying of COVID in 2020 was 82. They were people who were nearing the end of their lives anyway. The disease posed almost literally no risk at all to healthy people under the age of 60. That is not the case with the disaster now unfolding, because now there are children and young people with cancers which could have been treated had they been diagnosed earlier. We are seeing a wave of preventable deaths among people a good deal younger than 82. Winter is indeed coming early this year.